Hello, I'm Dr. Benjamin Yip, Consultant Gastroenterologist and Medical Director at Alpha Digestive and Liver Center. Today we are going to be talking about gastroscopy and colonoscopy. Gastroscopy is endoscopy of the stomach, which is the organ after the esophagus or food pipe. So during the procedure, we can take biopsies of the stomach lining, which can tell us whether a patient has intestinal metaplasia or Helicobacter pylori infection, both of which increase stomach cancer risk. If there are polyps in the stomach, we can also remove them, as some of these polyps may turn cancerous. So gastroscopy and colonoscopy are the gold standard tests to evaluate one's stomach and colon. These tests are more accurate compared to blood tests, stool tests, and scans. Gastroscopy and colonoscopy are both endoscopy procedures which involve inserting a tube with a light source at the tip and a camera, and allows us to visualize in real time the linings of the organs that we are looking at. Gastroscopy allows the endoscopist to look at organs such as the esophagus or food pipe, stomach, and duodenum. Colonoscopy allows the endoscopist to visualize different parts of the colon from the rectum all the way to the cecum, and sometimes we are also able to get into the last part of the small intestine, the terminal ileum. For gastroscopy, a throat numbing spray is usually used before the endoscope is inserted down the patient's throat. Prior to any endoscopy, an intravenous cannula or a line to the patient's hand vein is also put in place first to allow us to give painkillers and sedatives to make the procedure more comfortable. So these are not very painful procedures. Any person with symptoms attributable to the esophagus, stomach, or duodenum should undergo gastroscopy. Likewise, any person with symptoms attributable to the colon or large intestine should undergo colonoscopy. Some of these symptoms will include acid reflux, abdominal pain, abdominal bloating, passage of black stools, or blood seen in the stools. A person with a family history of stomach or colon cancers should also consider having these procedures done. For gastroscopy, fasting, i.e. no food and drink for 6 hours prior to your endoscopy appointment is required, and the patient should arrive at the facility half to 1 hour before the procedure time, and the staff can then sign you in, and then you'll be brought into the room, after which an intravenous cannula or a tube is inserted into your hand vein, which allows the doctor to give you sedation and painkillers. Then a timeout procedure is done to confirm that you're actually the patient, and the gastroscopy can commence after a throat numbing spray is given at the back of the throat. For colonoscopy, the process is similar, except that the day before you need to take laxatives to clear your bowel, and that continues on the day of your colonoscopy as well. Also, the observation time for colonoscopy will be longer than a gastroscopy, usually in the region of 1 to 1.5 hours. These procedures are very low to low risk procedures. For gastroscopy, the risks are in the region of 1 in 1,000 for bleeding, 1 in 10,000 for damaging the surface of the organs that we inspect, and for 1 in 1,000 chance of affecting the brain, heart, and lung as we have to give sedation. For colonoscopy, the bleeding risks are 1 in 100, and the risk of damaging the lining of the colon is 1 in 1,000. The sedation risks are similar. However, for colonoscopy, there's up to 10% chance of an incomplete procedure, especially when one's colon is too angulated or twisted.